Patrcik.
From here on out, it says Patrick FABER, just correct them. I know that's a little bit annoying and pretentious for some people, but they need to know. It's not somebody's last name. It's an acronym. What does it stand for? You know.
Flex, abduct, external rotation.
Yeah, flexion, abduction, and external rotation of the hip. So it tells you what position to put the hip, which is basically a figure 4 position. Some people add the E to the end. That really screws people because that really makes it look like FABER. Or however you would say that. A lot of people say FABER. And the E might be after you put the patient in that position, you extend the hip. But that really messes people up because some people are like flexion of the hip, abduction, external rotation. How do I flex and extend the hip at the same time? And it's really what you do at the end. Yeah. They think it's hilarious. You can close that if you want. If not, we just keep making fun of us. Alright, so we put the patient in a figure 4. Let's go ahead and put your hand on. And we put the foot up, usually just superior to the knee, right? Ankle superior to the knee. Because if it's on the kneecap, it just feels a little bit weird. And then the other hand's going to go on the opposite ASIS, and we're usually going to have the patient put their hand there. So put your hand over this bone. There we go, just one full hand. You want to make sure the palm of the hand's over the bone, not the fingers, because then it'll feel a little bit tender for the patient for you to push on their fingers. So I'm holding this leg up like that until I stabilize the pelvis. If I don't stabilize the pelvis, now Michelle's flexible enough where not a lot happens. This weird clicking in me. Oh, it's happening at the hip. But her pelvis is moving. So I don't let this leg drop until I stabilize the pelvis. And now I move the hip into extension. So I feel it stop, and then I oscillate there. You get any clicking there. That clicking might have been SI joint clicking. So, if she experiences pain in the hip, where would she notice it? Yeah, around the trochanter, or maybe like deep in the groin, like that part of the hip, capsule itself. If she's experiencing pain in the SI joint, where would she report pain?
On the back.
There. So we have to be able to have the patient local or tell us where the pain is coming from, where they sense that pain, to be able to say, okay, that's stressing the SI joint or the hip, and that's what I'm